So I wanted to start with a little bit of big picture stuff, and the other panelists we'll try to not overlap too much. We planned a little bit, but so I want to start by saying misinformation, disinformation. First, you have to make the distinction. I think misinformation is not deliberate. People learn and come to accept things that are not true for a variety of reasons. More concerning is disinformation, the deliberate spreading of untruths. I think these are a serious problem. I think they are essentially a pandemic. I know we don't like to use that word because of COVID, but it's a pandemic because it threatens our health individually, collectively, threatens the health of our planet because of climate denialism, threatens our democracy as we're seeing the U.S. unravel. To me, the disinformation, the deliberate spread of falsehoods is the much bigger problem, the one that we have to address. But misinformation has a real role to play as well, especially in the vaccine field. We need to bear in mind that especially the disinformation is done for financial and political gain. This is not done accidentally. There's a reason for it. People are getting very rich and more powerful by spreading a tsunami of lies and half-truths and conspiracy theories. And I don't have to name names, but in the vaccine realm, disinformation is spread essentially by about a dozen people in the world, most of them based in the US, and they are all getting very wealthy. You can read, you can Google a very interesting study called the Disinformation Dozen. If you want to know I can give you the names after if people really care. I have the list in my head. But we have to recognize, too, the role of social media, that I think this disinformation and misinformation has become part of their business model, unfortunately. They want eyeballs, they want clicks, and the best way to get them is fomenting outrage and fear, and that's what this does. Every time I put my arm down, I buzz. Weird. I think it's because of the chip I got when I got my COVID vaccine, but I'm not sure. I'm also a big fan of history, so I think it's important to remember that these problems have always been with us on a certain scale. I like to tell that if you know the story of smallpox and smallpox in Canada, in 1905 there was an outbreak of smallpox in Montreal. It was the biggest in the world. It was very, very deadly. We did have a smallpox vaccine then, but 20,000 people attended an anti-vaccine rally. They carried coffins, things like that. It was very histrionic. The population of Montreal then was only 100,000. So imagine if 1 in 5 people in a city like Ottawa or Toronto came out and opposed vaccination. We're nowhere near that level of distrust and worry. So I think we have to keep some perspective. What's different now is people have much bigger megaphones called the internet. It's much easier to spread things that are untrue and spread them very, very quickly. And it's a challenge for people on the other side, for public health, to be able to react quickly. It's not really a fair fight when you have to use the truth. I think we have to bear in mind, too, that the reality is that the vast majority of children are vaccinated. Most people have no problem with vaccination. They may have concerns, but let's not lose sight of this for the small, very loud minority like the RFKs of the world. Now, this being said, we can't take for granted that vaccination is going to continue at current levels, but sometimes we have to ask some really difficult and uncomfortable questions, like, does it matter if we get to 95% anymore? We live in a different world. Now, I don't want to give too much credence to those arguments, but there is some truth to them. It is different. Is the spread of measles the same today as it was in 1950? No. So we have to think of these things and we have to adapt. Finally, the last thing I want to say is I think the real issue here is much bigger than misinformation, disinformation. It's the collapse of trust in the world. It affects public health, but it affects everything else. Mistrust is a real poison that we need to address, and we're seeing it much more in politics than we are in healthcare. The reality is the most trusted people in society are still doctors and nurses, and that's a good thing. When we talk about trust, though, we often ask the question, why don't people trust us? But I'm stealing this line from someone who chatted with me earlier, but I think we have to ask the question, too, why are we not trustworthy enough? what are we doing wrong? There's some real self-analysis that has to happen here. And when I say we, I mean the media, I mean public health, I mean clinicians and society more broadly. Last thing I'll say, because one thing a journalist can do is keep a deadline, so I'll keep to my 5 minutes, is that very few people are anti-vaccination. Again, let's keep our context. Lots of people are hesitant, but I don't believe that any parent wants to harm their child. I think everyone is well-intentioned. They may do the wrong things in our view, but we have to be careful not to vilify them. We have to be careful to not drive them further into the other camp, to make them embrace conspiracy theories. We have to be open-minded. We have to try and understand their fears and their concerns, and we have to address them in a different way, because obviously the way we're communicating now is not working well enough. Prativa?
Thank you. We're actually going to go to Ray next. Yep. We're all sitting out of order just to keep everybody on their toes.
This thing on? Oh, it's on. Is this on? Yeah? It's on. Okay, good. First of all, so nice to see everybody here. I didn't anticipate this size of a crowd. That's fantastic. And if anybody wants to buy us drinks, I'm sure we won't say no. That'll be good. There's so many things to say about this topic. It's hard to sort of narrow it down to just 4 minutes worth of an introduction. One is that this, to me, is the pandemic of our time that may last a generation, if not more, the misinformation pandemic. And it's going to, it is already corrupting every aspect of public and private life. Pretty much every government department has it on their agenda to discuss. Every corporate department has it on their agenda to discuss. And, André has distinguished between misinformation and disinformation, and those are real distinctions. One of our colleagues, Marco Zanoni, said earlier today that every case of misinformation has as its origin disinformation, because people don't spew nonsense out of a vacuum. They've been driven to do so by some organized, well-funded, I'll say it, evildoer. And looking back on that, I remember when Russia first invaded Ukraine years ago, and back before elongated muskrat bought Twitter, more rational people were in charge, and they decided to shut down the Russian Twitter accounts and the Belarusian Twitter accounts. An amazing thing happened that week. Suddenly, all of us who were engaged in public science communication, we weren't attacked. Suddenly, all of the misinformation merchants in public health disappeared for that week. It was amazing. And the lesson, of course, is that a lot of this is driven by well-funded disinformation merchants. Now, I can go deep into that. I won't. What I really want to focus on right now is what I believe is a susceptibility in the general population to receiving nonsensical or misinformed information. And some elements jump out at me. Obviously, we have a bit of a public education crisis when it comes to this topic. One is, I think there's a subtle kind of innumeracy at work. And no one will ever say to themselves, I'm innumerate, I don't know math. No, that's not what I'm talking about. There's a fundamental inability to understand some aspects of mathematics, in particular, exponential growth. Nobody really has a solid, guttural understanding of exponential growth, and yet it drives our investments, our pension funds, and it drives infectious disease. So back during the worst of the COVID pandemic, when we told people, look out, this is growing exponentially, people are still thinking linearly, and they couldn't foresee that. Number two is that we have a hard time distinguishing between individual and population risk. If I say to you, this disease has a 1% chance of killing you, that doesn't sound serious, but 1% of the population, if 1 million people got infected, that's a lot of deaths. That's 10,000 deaths right there, right? So that suddenly is a huge thing at the population level. Then there's the inability to see nuance and probability. Everybody wants to know, will the vaccines prevent me from getting sick? Yes or no? I said, well, it has a 64% chance. What does that mean? Well, it means it got a 64%. All these people got vaccinated, then 64% probably won't get sick. And we don't have a good way of digesting that information. So I think that part of the conversation we'll have today is how we invest in public education so that the next generation, because I think, frankly, we've lost a generation. The next generation is better inoculated, pun intended, against bad ideas and people who want to do us harm through the medium of information. Thank you.
Thanks. So First of all, I want to reassure you I'm pro-vaccine. I wrote a comic book about vaccines. I've co-founded a company to help with vaccination. But I think we have to confront some hard truths. The world is changing, and we need to change. Populism is here to stay. We're going to have to learn to live in an environment with populism. People want to have more control over their decision-making about their health. And what would have worked 30 or 40 years ago may not work now. And we're going to have to adapt. And public health is a hard job here. As I said during the day session, getting 95% of anybody to do something is incredibly difficult. And in politics, you can get 40% of the vote and get a majority. Public health has to get 90% of the people to agree to do something. And in this world, that's really hard. There was a time where we all listened to the same record. Now that doesn't happen. Everybody's got their own thing. So early on in my career, I started studying this, and I did some work with the Naturopathic College, and they were great. They worked with us. And we surveyed the students, and we found that in the last year they were less supportive of public health and vaccination than in the first year. And they don't teach vaccines in the Naturopathic College. In the Chiropractic College, they found the same things. It was published at the same time. And so, I said, well, I'm really smart. I know what to do. I know how to solve this anti-vaccine stuff. So I took the final year students, and we divided them into two groups. And said, well, they just need to see the disease. So we had someone from the March of Dimes come in who had polio to tell their story, anecdotal story about what their life was like. And I did an epi lecture on how the disease has changed since the introduction of the polio vaccine and before and after. So science versus an anecdote. So what do you think I found? What's that? I made them more anti-vaccine, particularly in the anecdote group. And they complained to the dean that I didn't give the other side, and I realized I wasn't as smart as I thought I was, and what was going on with cognitive dissonance resolution. These were deep core beliefs of these people. This was part of their identity. And so what was happening was people who are a little different, who have different beliefs, find other people like them. And then that reinforces their belief, and they realize, oh, maybe I wasn't so different after all. And that was happening geographically at the alternative schools, but now it's happening virtually. They're finding their own networks, and they're getting very strong opinions. And then we challenge those, and I will say I don't like the term misinformation. I find it doesn't help with communication and crossing the divide on this. And we have made mistakes in public health. We thought there'd be herd immunity from the COVID vaccine. We thought you might only need a couple of vaccines. This wasn't with any malintent. It was an understandable, given the situation. There were side effects. But we weren't purveyors of misinformation. I guess you could argue technically we were, but not with the way it's being used now, I don't believe, the term. So I feel that stops a conversation. And, I like to quote John Stuart Mill on this. You have the right to be wrong. You have the right to voice your wrong opinion, and we need you to do that because an unchallenged idea is not a fully formed idea. So, we can't shut down discourse that we don't agree with. And I think we need to really work twice as hard to engage now. And I think there's hope. So I'd like to end with some positives. I think, first of all, the measles outbreaks were handled really well. I don't think there was blaming. I think it was handled by finding opinion leaders in the community. We didn't point these people out and make them identify them as causing harm to others. So I think that was really well done. And I just sort of, in another anecdote, I said, we just had a paper that on vaccine passports, and the National Post wrote about it. And normally that would get me like a lot of hate on the National Post. But we actually were just sort of balancing. Maybe you should, maybe you shouldn't, right? Like, it really depends. And I was surprised that the comments were actually quite reasonable. I think people are very open to a reasonable dialogue on a lot of these topics. And, if we can't think about the ones who are on the extreme, and we can't focus our discourse designed for them, because that'll turn off the people in between.
Thanks. Hi, everybody. I'm going to respond just to what Kumanan said, and then I had a couple of points that I wanted to make. There's a really great podcast called Why Should I Trust You? That's from the US, and it does a phenomenal job, to Kumanan's point about bringing folks with different perspectives together, because I think we're kind of at this point where we have to communicate and chat with others who may not necessarily be as pro-science as we are. So just a really interesting podcast for those of you who are listening in. To add to what's already been said, I just wanted to add a couple of additional layers of complexities that I've been thinking about since the pandemic. There's misinformation, disinformation, there's the information ecosystem as it is, and then there is that within the context of emergencies. And I think we saw that in the context of COVID. And I think we've done kind of a terrible job at getting people to understand how the scientific process works, right? That there is no certainty, at least not right away. And when there's a crisis, people are looking for comfort, people are looking for answers. And if they don't find it, then they go to people or influencers or platforms that provide them that certainty. So if we don't step up and fill that information void, then they will find community, to my colleague's point here, on elsewhere, even if that community is providing falsehoods, rumors, or just false information. So that's one piece. The other piece that I wanted to talk about as well is just the definition of misinformation and disinformation. I think sometimes we tend to focus on the definition and not necessarily on the intent, and also recognizing that there's a lot of mushiness in between the two, right? So I'm thinking of, for example, there's this example that I use when I teach this course to my students, where The Onion, who, as you all are aware, it's a satirical media platform, said that Kim Jong-un was the sexiest man alive. And in North Korea, they just ran with it and they just celebrated that. And it kind of makes you think of, there's false information that leads to harm. And then there's others where, did this actually cause harm or did it not? It's questionable. But when we're looking at false information or misinformation in the context of emergencies where it could block response, then we're talking about real harm. So sometimes I think we kind of get stuck in the terminology, and it's important to understand that. But there's a lot of in between, especially because we know that, for example, a lot of conspiracy theories out there, there's a little tiny element of truth that led to those conspiracy theories. And so it's nothing, I don't think it's as easy as saying true versus false or right versus wrong anymore. There's a lot of in between. And then communicating that nuance, I think, is something that we need to get better at. The third piece was something that a couple of folks have already mentioned, but just the fact that this is a really big multi-million-dollar orchestrated industry that benefits a lot from this. And I think sometimes we tend to think of misinformation as a couple of keyboard warriors in a basement somewhere that are, saying the wrong thing. But really, we're talking about, big industries that are benefiting off of this, and this is nothing new. We had that with the tobacco industry. We see that with folks who are doing, climate denialism and whatnot. So something to keep in mind, particularly when we're speaking with communities, that this is not an individual problem. It really is a big structural issue. And then I was asked to talk a little bit about solutions, because this can feel a little doom and gloom. So I just wanted to talk about a couple of solutions that we've been thinking about. Obviously, there's the whole upstream, downstream piece, debunking, pre-bunking, and whatnot. But there's two that I'd like to talk about that I've been recently working on. One is really, I think there's a couple of academics in the audience, just thinking about the role of academic institutions. So as a little anecdote, I was a PhD student, I'm an epidemiologist, and I had never, ever received training in science comms or risk communications. And yet I was doing that on the side. So I think there's a lot that can be done from an institutional level to train public health folks, grad students, anyone really, in communicating uncertainty, communicating risk, communicating during emergencies, and incentivizing that too. I think that's slowly changing, but a lot of the incentive structures in academic institutions very much benefit or require, publications and whatnot. So all of the science comm stuff, we do that on the side of our desk and are oftentimes even targeted for it, especially if you're pro-vaccine and you're vocal in certain platforms like X, for example. And then the last thing I'll say is just I think we also need to be a little bit more creative in terms of our solutions. So I'll focus on the training as well, just because I teach risk comms and misinformation to students. And one thing that we've been doing, that we just started doing in January, is using AI and VR to train public health leaders and leaders of health agencies to combat misinformation, quote unquote, live. And so what I mean by that is that they're not facing angry audiences for the first time live. They're doing it with angry audiences of AI-generated avatars ahead of time. So they're practicing communicating in the context of different emergencies so that when they do face that in real time, they're a little bit more prepared. And that's a new course that we just started offering in January. So I think just being more creative about the tools that we have and seeing how we can train a better, more trained public health workforce, at least from a comms perspective, would be really helpful. Okay.
Thank you to all of our panelists. So we will open it up for questions. As I mentioned, there's a mic in the middle of the room, so I would encourage you to please, if you've got a question, please do get up and ask away. It's a friendly environment, and that's what really makes tonight a great opportunity, is for some discussion. So maybe while we're waiting for the audience to sort of warm up and think about some questions, I'll ask if the panelists want to respond to anything that was said, and if not, then I'm looking at Ray, and then if not, I can get the ball rolling. I know you're tempted, Ray.
I mean, it's like Kumanan and I talk about this stuff a little bit, and I disagree that you can't get 95% of people to do something. We have in the past, and we can in the future. I think it's a matter of winning them over to a certain logical outcome. One thing I want to say is, I mean, the U.S. is about to lose their measles elimination status. We've lost our measles elimination status. The U.K. has lost their measles elimination status. You know who's about to get theirs? India. Right? So the rest of the world seems able to do it. Something about the West is crumbling in some ways. And yeah, we did do the measles response very well from a public health standpoint, but there was a fairly vocal contingent of the population blaming immigrants for it, and particular kinds of immigrants. And so the amount of hate that percolated out of this situation was quite extraordinary. So this is not banal or benign in any sense of the word. So I do think that we are, what's the word I'm looking for, giving ground of social leadership to other parts of the world because of our inability to get our social contract in order. That's all I'll say.
I'll just say, Ray, they won in the U.S. Like, the reality is they're in charge of the health system. And that anti-vaccine sentiment may have actually helped Trump win to an extent. So we just have, I think, obviously we want to hit 95% coverage. We want to, I said, I support vaccines, but I think we have to be realistic of the situation. And it's not surprising it's in the Western countries you're seeing this, because individual rights, liberties, and individual choice are more of a priority here than in some of these other countries.
I'll respond as well. The other thing that I think about is it's not as simple as it's no longer just about public health, right? A lot of the literature shows that it's really about identity. And so all of a sudden there's, for example, I did my graduate studies in the States. So a lot of the literature that was coming out was, if you're a Republican, you are this. If you're a Democrat, you are this. And then all of a sudden this tribalism occurs where it's no longer about making a decision just based on evidence or on sources of information. It's really about party lines, and it's really about community to a certain extent. And so I think because of that additional layer of complexity where that decision is hand in hand with who you consider your identity to be, it's a lot more complicated to get folks on board with just get vaccinated.
The other thing that I haven't heard that I'll just add is I think we have to pay attention to how we vaccinate too. We don't do, kids shouldn't feel pain when they get a vaccine. We can prevent that. We have things like a cream called Embla. We can have numbing cream. We have to make it easier for parents to do it. Why do people not get vaccinated? Not very few do it because they're anti-vaccine. They do it because they can't get daycare. In some cases, not in Canada, where our vaccines are still free, thankfully. Sometimes they can't afford it. It's too much trouble. They want to fit into their community. There's a 1,000 different reasons, and we have to not just have this black and white anti-vaccine, pro-vaccine. It is complicated. People believe in this, but we make it too difficult, and we traumatize children, and they remember that. Someone said this morning at the other event we were, unvaccinated children become unvaccinated adults. Who suffered the most from measles? Pregnant women. Why were they not vaccinated? Probably something in their history. So we have to remember this stuff, that it has to be, I'm from the generation where suck it up. You're going to get your smallpox shot, and it's going to be this big jab in the arm, and it's going to be awful, but tough, suck it up. And we don't have that attitude anymore, thankfully. People have agency, and they should, and we should make it easy.
Super, thank you. We already have a question at the front of the room, and then we'll go to the back of the room.
Okay. Yeah, this is a follow-on from what Ray was saying and their other comments about the education of people to understand things like the probabilities and exponential growth. But there's another area, I think, that deserves attention in the education sphere. I'm a biologist, by the way, and the biology of immunization has been with us, knowledge about it has been with us for like 100 years, or since Edward Jenner anyway. And I'm not sure how much of this gets taught in the school. I think it would help. And another observation I've made is whenever I try and have conversations with people about COVID vaccination, and we talk about RNA or DNA, you have people who instinctively thinking of genetic modification, interference with God's mechanisms and stuff. But anyway, I just see that the RNA vaccines seem to get a lot of attention with anti-vaxxers. I think because of an association with other sort of genetic manipulations that science is capable of. So if you have any comments about the biology of these things, I'd appreciate it.
So on your comment about teaching the children, that's actually why I wrote the comic. Actually, my wife volunteered me to give a lecture in my son's class, and it was kind of cool. It's actually like Star Wars was coming out, and it's actually not dissimilar to Star Wars, how the immunity is provided and the antibodies work. And so we made a comic book and trying to teach kids. Because I agree, I think it's really interesting, and let's make the only experience with vaccines is negative for the kids, so let's try to make it a positive. So then I wrote an op-ed in the Globe about that, and boy, people were not happy. They said we're indoctrinating and brainwashing children now. So, that's how it goes. I'm not saying it's a bad idea to do it, but it's just be aware. I have to be aware of those type of issues.
Sorry.
Another part of your comment at the beginning was about risk communication. And I think we have to acknowledge that's really difficult, especially during something like COVID. The risk was changing continually. I think we have to not be afraid to say the words, I don't know. I think that gives people comfort. It doesn't scare them. When I often speak at medical schools, and I tell students of medicine, the 3 most important words you can learn are I don't know. You have to be humble. The vast majority of stuff we don't know, especially when it's moving quickly. And that doesn't bother people. What bothers people is to get false reassurance, to be told things, that they find in retrospect are exaggerated. Like, people are very angry that we told them, oh, you're just going to get a COVID vaccine, everything's going to be fine. Now, as we heard, we didn't do this out of malice, but it stuck with people. So we should have hedged that a little bit, maybe. But then I know the public health people in the audience will tell me at the same time I say, just be firm and don't have any nuance. But you have to find the right time and right place for the nuance.
Full disclosure, Dr. Harrison is my father-in-law, so I'm not allowed to disagree with him in public. And I won't, if he's right, but I will add that it's it's insufficient just to teach biology. We have to teach the scientific method. We have to teach why we follow the scientific method. So what I'm fond of saying is, at the end of every comment I make to the media, I try anyway, I'll add, all of this is true until further notice, because that's the scientific method.
Just to add to that as well, so Finland, and to complement Ray's point, Finland has this really great curriculum called critical thinking curriculum, and they introduce that to kids when they're in elementary school. And so there's a really great PBS documentary on this if you're interested, but it's fascinating because the little kids, when you tell them false information, they'll question you and they'll say, well, actually, I don't think you're right because I didn't see this in that source, or I didn't see dinosaurs when I was walking home from school. And they've done such a great job at integrating that from a very, very young age. And I think that's kind of where we need to go, because critical thinking is at the source of all of this, right?
David Sweener, and I've spent over 40 years as a lawyer working on health policy, mainly on tobacco and nicotine issues, and this has been a huge part of my existence, starting in the 80s when it was cigarette companies misinforming people about cigarettes, to now where it's often public health people misinforming the public about nicotine. So we end up with this massive amount of misinformation. And picking up what André was saying, we were talking about earlier, Professor Peter Sandman's work about public health keeps saying to me, why don't they trust us? When they should be asking, why aren't we trustworthy? And he makes the point that many of the people who have moved against vaccination during COVID, it wasn't that they were caught up by all this misinformation from nasty people on the internet. It's that they lost faith in the authorities because of what they saw coming from the authorities that they didn't believe in. And so they looked for an alternative source. And as Hakutani's book, The Death of Truth, talks about, once you start finding better information from some non-authoritative source, like on the internet, than what you've heard from an authority, it's a very short trip to believing all sorts of crap. And so we know in public health, when we're talking to the public, we're saying, we need to understand their lived experience, meet them where they are, empower them to make better decisions about, well, if we look at our audience as being the public health establishment, how do we apply that? Because what we're seeing are people who refuse to engage on issues like this. They'll have a doctrinaire position. They will be very upset if you dare to question them. And they're saying many things that turn out to be false. People can know they're false and turn against them. So if we're going to deal with that, why don't they trust us? And we applied that same thing from the sociology of medicine, of public health. How might we best approach the people who are destroying that trust by the way they interact with the public? What do we need to do to meet them where they are, understand their lived experience, and somehow empower them to be more of the solution than being part of the problem?
I got some thoughts on that. First is, what does it mean to be trustworthy? Like, what are the characteristics of a trustworthy person? Is it someone who admits their faults? Is it someone who imbues confidence? Is it someone who is charismatic? I think different populations have different ideas of what that means. And if you look at who the primary grifters are, the ones who seem to command a lot of attention and sway, they seem to be highly confident individuals who never admit they're wrong. And yet scientists were always hemming and hawing and saying, on the one hand this, on the one hand that. We're being quite honest, yet that for some reason is not perceived as being trustworthy. And it was said earlier that, if you're not getting information that you perceive as being trustworthy, you will find other information that you do perceive as being so. If you look on the internet, and by the way, as a caveat, I'll add that prior to there being a COVID vaccine in existence, there was already anti-COVID vaccine material circulating. It had already been well-funded and prepared and projected. So it's not just about untrustworthiness, is again the organizational aspect of this. So if you look on the internet about compare the trustworthy or the factual information versus the non-factual information, one thing really jumps out, at least to me, and that is the non-factual information is so well produced. It's so slick. It's easy to understand, and it's simple. And I think back at someone commented decades ago about why talk radio skews right-wing and non-talk radio skews left-wing. And here's my political bias, because I'm not a right-winger, is that to be simple is to be wrong. Like, that man is homeless because he's lazy. It's simple. It's easy to understand. It hits the talk radio notes. That man is homeless because of a variety of socioeconomic factors and is more complicated. It's harder to understand. So we're automatically at a disadvantage to tell the truth, and that is perceived as being untrustworthy. That's my feeling.
Yeah, just to add to that too, I think this topic is so tricky because it's not just about science or vaccines, right? When we're talking about trust, we're talking about trust towards institutions, trust towards governments. So then all of a sudden, you're no longer just talking about vaccines or public health. You're also talking about, is my government protecting me? Is my government giving me the tools that I need in order to have groceries? And when there's just so much lack of satisfaction towards quality of life, where people are having a hard time economically, then I think there's a lot of anger that bubbles up. And as a result, that lack of trust translates across everything, including public health. So if we really wanted to be trustworthy, we would fix every single structural issue that we have, and then we would get the trust. But I think just looking at it from a public health angle alone with regards to trust kind of misses this bigger picture that we really need to tackle with regards to trust.
Study I talked about at the alternative medical school, that same thing applies to us as well. Like, we're a community here, and we get reinforced by hearing, people with like-minded views to ourselves, and we're also at risk of cognitive dissonance resolution and rejecting the people who provide different ideas to us and having reactance. Yeah, I think public health has actually gotten a lot better at this, but there wasn't a great period. First, you couldn't even talk about anti-vaccine because you were giving credence to it. And then there was, I remember family docs were firing patients whose children weren't vaccinated, and that made no sense at all. And I think that the association said you can't do that. But we have to realize the biases, cognitive biases we have. And it was obviously tough for public health during the pandemic. They were under attack by so many people, and it's natural to retreat back into your community and get reassurance from that, but it does cause some cognitive biases to form, and we have to just be aware of those biases. In medicine, I always tell my residents, the number one mistake you're going to make is with that problem patient that everybody's saying is difficult, because there's usually something that's at it, and you just dismiss it. And then, when that disease manifests, you look like you were dismissive of the patient and you had labeled the patient. So you just have to double down and really work through that reactance when you're confronted with that.
I've been working in the immunisation field for a long time. When I started in the first year was the year that I worked at national level in immunisation, was the year that Andrew Wakefield published his paper on MMR and autism. So we went through everything that I think Canada went through a bit later, because it didn't actually arrive here till sometime later because of very good journalism. I wanted to, on the trust factor, I think we can really cheer ourselves up by thinking that people still trust their own doctor. And don't forget that. And I think a lot of the discussion, the reason my question for you is really about science, because we talk a lot about science. Everyone knows that the information deficit model is not the right approach. And part of that is because science actually isn't the answer to most people's concern. They want a trusted person, and they don't actually care about, they don't want to believe what the person says. They believe in the person, and then they believe what they say. So we end up going down a bit of a blind alley when we talk about science. One example was there was a famous... well, not famous, he became infamous at the time. There was a science teacher in Ontario, some of you may have heard this story, who went and shouted at kids in the lineup to have their vaccines in school, saying, "Don't do it, you're not having informed consent, you mustn't do it, it's dangerous." And it all got in the news about this science teacher being anti-vaccine. And around the time that we were trying to deal with that, and I did some media around that incident, I got a letter from an English teacher in the same area of Ontario saying, I just wanted to reassure you. I heard you on the radio. I just want to reassure you. I use vaccination as a way of teaching thinking to my students. So it's back to the Finnish example is a brilliant one. You know, and she was an English teacher, but she knew that she wanted to, you know, explain to students how you think about this. How do you find information? How do you assess information? How do you think? And a similar experience to that was when I was teaching at the MPH at Dalalana School of Public Health at U of T, where I'm a prof. I taught one course which was about how you think in public health and how you deal with uncertain evidence and put together advice. And the students who had the most trouble with that were the basic science students. And there's a lot of arrogance in science, I have to say, where people think we know how to think better than everyone else. But actually, you haven't really been taught critical thinking in uncertainty. And so, you know, you had people coming in, you had like a, you know, really brilliant degree in biochemistry, never written an essay, didn't know how to construct an argument, had no idea what to do when none of the studies gave them the answer they needed. You know, like they had an answer, you know, a paper that was almost right, but it was from India. So can we use that in Canada? Or there's another paper that was like completely, you know, all of that stuff was, they had huge anxiety about it. So I just, you know, that as scientists, and you know, I count myself as a, you know, nerdy scientist, I think, oh yeah, that's the answer, and I can figure it out. But I've come to learn that that's not what works for other people. So, you know, how do we actually get people to think well? And it's not just about communicating in science, because we saw in the measles, during this measles outbreak, and thank you for your comment, Kuman, about it being well managed. I really appreciate that. I'll take that back to the team. There were many people speaking really well in the media, very engaging, and saying things that were completely wrong about what was happening. And so they probably did your course and became very good at communicating what they thought was going on in Canada. But they were wrong about it, and they didn't ask people who do know necessarily. So, or at least I don't think they did. They didn't ask me anyway. So this is all to say it's all a bit more complex than it seems to be, and that science is not the answer to the problems we have in terms of some of these things. Where it is the answer is, I think, in some better engineering solutions. So I think we could easily get 95% coverage if vaccines were given by patches and were like vitamins. You know, all the ones we know an awful lot about, and you just went along and got a nice... I've talked to Heather a lot about this. You go along and you post them to people. You know, like there are engineering solutions to some of these issues, like the way seatbelts, no one thinks about them anymore. Safe drinking water. No one has. You don't have to think about it. You don't have to worry, and you don't have to worry about a needle, and you don't have to worry about pain. So there is a really important place for science in all of this, but it's not going to solve the problem of trust and mis and disinformation unless we think about it very broadly. But I'd like to hear your views on that. Thanks.
Yeah, you know, I think early on in the pandemic, I think you were quoting Scientific American. You were interviewed about the sterilizing versus protective immunity, and like I didn't really quite grasp that at the time. You know, we just sort of assumed a vaccine was going to give us sterilizing immunity, and we were going to get herd immunity, and that, you know, realizing most of our vaccines actually don't do that. You know, I think you reflected the uncertainty, you know, and I think that was something where we really wanted certainty. Everybody wanted certainty on that thing. We wanted to be certain this vaccine was going to give us sterilizing immunity, and we'd had herd immunity, and we'd be out of this. And I think that really did us harm, conveying that and saying 2 vaccines that were done. And I think that might go back to your point about these scientists wanted a clean answer to this, and it was not clean at all. And understandably, it wasn't clean. It was a very, very unusual situation with very novel science. And I remember talking to Brian Ward saying, you know, what I've learned is we don't know anything about immunology after seeing how COVID works. But yeah, the default, I think, was to look for simplicity where there wasn't simplicity.
So one easy question, one tricky one. The easy question is, do you find the health disinformation ecosystem is less hostile now than in, say, 2022? the actors that are currently occupied, maybe attacking other topics like spinning to wipe out opposition to ICE killings and stuff. So do you see that? That's a easy question, I hope. The harder one is something you said. I'm sorry, I forgot your name. But how do you crack the identity alignment problem? Right? So Frank Graves did a ton of polling showing conclusively that you can measure anti-vax sentiment and you can predict who was the aggressor in Russia. Should we do something about online disinformation? Do you support the CBC and a host of other things that are all lined up with a correlation coefficient of like 90%, right? Unbelievably high for polling information. How, as public health experts, do we crack that identity alignment problem? Do we cut it? Do we do something? Really need to know this. Thank you.
Yeah, those are big questions. Oh my goodness. So the first one, has it become less hostile? Yeah, it's become less hostile, at least from my perspective. I don't get death threats anymore. Now I get like, you look funny. Okay, I can take that. And they've shifted to other targets, like the ICE killings and so on. And I think the reason for that is the ones who are most hostile, a lot of them were bots, and a lot of them were organized and well-funded, and now the turrets have shifted. That's easy. And that really is more evidence to how much of this is organized. The second part, how do you solve the tribalism, really? And it's, as a public health person, you can't. I mean, you haven't got those tools. The people who have the tools are the rest of civil society, leading from the political parties on down, especially those who stoke sentiments and use it as a reason or a mechanism for building cohesion within their community. So if hate is a value, then we have a problem. And yeah, for a lot of this is tied in with hate, sadly. So I have no solution except to say this is a multi-sectoral, multi-institutional, and pan-societal problem, and therefore everyone must be part of the solution.
Agree with Ray that this is a huge question, multi-sectoral approach needed. The small addition that I'll make is when I teach my students, we talk a lot about this, obviously, from a comms perspective. And a lot of the science communicators that we work with, what they say and what we say is when you're communicating science or communicating uncertainty, whatever it is, bring your own identity, not just as a scientist, but as a mom, as a member of society, so that you can really find that point of alignment between yourselves and your community. So there's a really great science communicator. Her name is, her Instagram name is Science Wiz Liz. And so she grew up in an anti-vax household, decided to do a PhD in immunology, and now she is a science communicator and has hundreds of thousands of following. And every time she talks to folks who are questioning science or questioning vaccines and whatnot, and including folks where that identity is very much wrapped to that anti-vax sentiment, she always brings forward her background, her story, and then also the fact that she's a mom of 2 kids. And so really finding other ways of connecting with the audience so that identity takes over and there's a common alignment rather than we're the scientists and you're the public. So that has seemed to helped and worked, but it's very much a long-term goal and very much a grassroots level goal, I think. Because when we're talking about fundamentally shifting the way that people view themselves and their identity, you're asking for a lot, and that's not something that just public health folks can do.
I think the tribal question is a really good one, and I think it's at the core of the issue here. And there's more than one tribe here. So, and it used to be largely women, crunchy granola types, alternative. And that was the pediatric vaccines, and then the COVID vaccines were the truckers, the typically young men, more libertarian types. So we have different tribes here. And I don't know exactly what public health did with measles, but I think that the plan is to find opinion leaders within their community. You can't go into their community as an outsider and tell them their beliefs are wrong. You need to find champions within the community who can talk to them, like to your point, Natasha, right? They have to trust the source of information. And I think we also need to be able to have discourse and dialogue and Ray's chagrin, I went and talked to the truckers when they were here, just to hear from them, see what they were thinking. I found out a lot of them were from Eastern Europe and obviously lived through regimes that were not, super open, and they had an inherent distrust. But there was also, my sense was, this was a metaphor for them feeling locked out of society in general. And you can't, if you don't have a discourse with them, you can't find that out. And then, I think you find that the opinion leaders within the tribe who can speak on your behalf.
Two questions, one looking back and one looking forward, and picking up, going back on the, the importance of science and trust and all that. I'm wondering if the public health community could have done a better job, not only of saying things are uncertain, but we've made mistakes along the way. And I'm thinking, for example, of focusing on droplets when it really turned out to be aerosols, or locking down far too broadly when it could have been more targeted, especially if there's more data. So I know some of you were heavily involved in these things. Looking forward, the business about the tribes, we're dominated by the internet and the algorithms that feed people things that they're more likely to want to hear. That's controlled out of Silicon Valley. We do have a minister of AI and stuff like that. So if I guess, ask you a question or put you on the spot, what would you have you and Solomon do in terms of Canadian legislation to try and break these algorithms?
I think there was an article in Science where they used AI chatbots to communicate with people with these pretty extreme viewpoints. And unlike us, the chatbots have a lot of patience, and we're able to slowly move people towards, more middling positions. So I wouldn't, instead of trying to legislate it out, people will find workarounds and stuff all the time, or alternative sites will pop up. And this is one of my concerns with school policies, that people will you'll put all of these people in like unvaccinated together in one community. We don't want that, I don't believe. But I think I think there may be a role for chatbots and AI in this to help with that discourse and connecting, moving people slowly to the viewpoints that we would like them to hold. But I think that work needs to be done there. So if I was going to advise Minister Solomon, that's what I would say. There could be some investment made.
I won't answer the question directly because I don't know what legislation we should have, but I'll say this. The traditional media, like where I work, if we publish stuff that's false or defamatory, we're responsible for it. We pay a price. That's not true with social media platforms. They have to have some responsibility for what they distribute. They want to be, on the one hand, treated like media, but they don't want to have the same responsibilities as other media. So if you spread lies, you spread defamatory information, you should be liable, just like traditional sources are. I think that would be a huge part of the solution. Now, it becomes difficult where are these things based? This all becomes very vague, right? Are they based in Canada or somewhere in cyberspace? But I think that is a big part of it, is we've given them a free ride. They can do whatever they want. They benefit from this. They profit from it greatly. I said earlier, fomenting anger and worry is what gets them clicks. And they do it through lies. And you can't just get away with that, or you shouldn't be able to.
I just want to respond to the first part of your question, which is about public health not speaking with enough nuance. During the worst of COVID, if you think back, public health wasn't saying a lot, actually. In fact, that job was downloaded onto volunteer scientists like myself and Prativa and Kumanan, and we took a lot of the brunt from the public for that. And I don't blame public health for that. They had other things to do. They're quite busy. But the inability to have a structured communication platform back then really bit us on the ass long term. And now, of course, I think we have more of an investment in communication. I'll tell you a story, though, about the droplet thing. It's an interesting story. I do a lot of legal expert work where I have testimony in courtrooms. And one time I was brought in for a murder trial. and had to argue that the courtroom was actually unsafe to have this trial because it was a raging wave at the time and vaccination rates were quite low. And I was arguing that because COVID was transmitted via airborne, and there weren't airborne precautions in this room, there was an X% chance of transmission. And the other side, who didn't want the venue change, brought in an expert to argue against me. They brought in Public Health Ontario to argue against me. So Public Health Ontario was arguing against me that this was a safe environment, and it wasn't. And they were using outdated evidence. Now, I'm not picking on Public Health Ontario. It's the nature of the system that the cutting edge information at the time was not something that was accepted in their halls yet. It later became so. So there was a slowness to the adoption of new information. And I hope that's changed, because if we're going to be nimble and respond in times of emergency, we need to be on top of current thought.
I'm old, so when I was in school, I learned about mitosis and meiosis. I'm wondering about the curriculum now, because I didn't learn about computers and coding, and there's only so many hours in a day. And I'm wondering how much basic science is actually taught. I also happen to have a son who is genetically immunocompromised, so I got interested in COVID quite early. And I started trying to read and keep up on things. And younger members of my extended family, after a year or so, just didn't want to hear about vaccines or masks and stuff. And I was trying to, as you say, meet them where they are and understand it. And it finally came out with, well, the rules keep changing. And I realized, I said, that's the point of science. It's supposed to keep changing. And I think if the communication had boiled it down a little bit better, that people would have understood it. Now, the young people I was talking to were pretty smart. They had business degrees and stuff, but then they were asking me about ivermectin. So I looked up ivermectin, and at that point I said, well, I'm not an expert, but it looks like they can't aerosolize it to get it down into the lungs where it needs to go. So I thought they were genuinely asking. And that's when it came out about, well, no, the information is being suppressed. There's a guy that won the Nobel Prize for it, for river blindness, and he wants to do it, and it's being suppressed. So, as you said, there's all these different angles to it. Another thing that I wondered, when I looked up what mild meant, after a while we started hearing COVID was mild, and I thought, well, who defines mild? What is that? And the definition I found, and please correct me, is that mild didn't mean that you needed to have supplemental oxygen. Well, that's not what most people think of if they think of mild. And I don't know anybody who isn't too busy to take a week off because they're sick and feel like they've been hit by a truck. So mild is also relative. And also that exponentially more people were sick than died. But we all got caught up in who's going to die, who's the highest risk of death. But then people forget, like their stores were closed, their doctor's offices were closed. You couldn't get, what you needed because stores were closing, trucks, supply chains, and all of those were impacted. So I think it is a multi-layered cognitive dissonance, but I think it's got to go down to the basic so that people understand we want science to keep changing. We want the rules to keep being redefined. Because if you suddenly get a disease, you don't want to know what was written 10 years ago. You want to know what's under study now. Thank you, all of you, for your expertise.
So I don't mean to dominate the microphone. Those are excellent points. A couple of things jumped out at me. One is we keep saying that we need to express our uncertainty more. And I agree with that. Scientists are innately uncertain. On the one hand, this, on the other hand, that. All our papers end with more study needed. We always say that, right? And I think it's true that we should lean into that more. However, the other side weaponizes our uncertainty against us. That's the other part of this. Like, he's not sure. Why would you trust him? I'm sure, and I'm sure the vaccine's unsafe. Look, he says more information needed. Well, how can you trust this guy? He hasn't finished his research yet. So that's a subtle issue. The second is your point about mildness. It reminds me that we use words in science that don't mean the same thing in the general public. Another comes to mind, elimination. Measles elimination does not mean measles eradication. And that was a big problem when talking to people about this on social media. That, well, it was gone, now it's back. Clearly it's the immigrants. Right? But no, it just meant that there's no sustained transmission. Eradication is wiping it off the face of the earth, which we did not do. So good points. Thank you.
I'm a big fan of teaching this stuff in schools. I think it's really neat science, and I would be a strong advocate for that. You know, I think when we look back at COVID, it wasn't really one pandemic, it was multiple pandemics. The virus kept changing, and decisions that were right at one time were not necessarily right at the other time. So when you actually look at the vaccine mandates, they reflected the science. Early on, we thought we had a 95% effective vaccine, and the reproductive number was such that you didn't need to have necessarily a coercive approach to get to what they believed at that time would be a herd immunity threshold. So that was, they would just do it voluntarily. When it went to Delta, then they needed to get a higher vaccination rate. So then the mandate started to come in, and it even came in Alberta because they were also had health services pressures. And then Omicron, it didn't make as much sense at all. So the part of the reason there was so much uncertainty is this thing kept changing. I mean, I expected it to mutate to Omicron right away at the beginning. I thought that was a natural progression. For it to get worse it was a bit unusual. So, yeah, I think it was a very difficult situation to navigate, obviously, and errors were made and good decisions were made. I think what I'm hearing, the importance of just recognizing that and admitting that, and I think people they know that this was hard. I think most people realize this was a hard thing to navigate.
Just going to add to that as well. I think a lot about the public perception of science, to your first question or comment, and how oftentimes when people think about science or public health, they think of bad things that you cannot do, or things that you're forced to do, forced to get a vaccine or mandated. And I wonder if there's a way that we can kind of shift that perception and talk about the wins that have made people's lives better. Somewhere along the way, probably during COVID, we kind of lost that because of the focus on COVID. So to a point that was made earlier about the fact that we get to drink clean water because of science, because of public health. And I feel like the wins of public health have kind of been neglected, or we just don't celebrate them as loudly. And so people's desires to invest in science and in public health is not there, because to them it just feels like it's constraints or things that they're forced to do that they don't necessarily want to do. So in addition to education, I think there's also a big marketing campaign that we need to do as public health folks to celebrate the wins and to see how all of the work that we do in public health and in science benefits people on a day-to-day basis, so that they can understand why investing in this matters.
I'd like to start by saying that I partially disagree with the statement that we should look inwards. Why aren't we trustworthy? Because I feel like that implies that there is something that we're not doing, or there is something wrong. And it neglects all of the systematic issues or the entire ecosystem in which public health exists. So one of the things that comes to mind is that we have actors that have perfected this strategy of disinformation. Public health is only one of the fields. We're seeing it in politics, democracies, law, everywhere. We have individuals, groups of individuals that have a multitude of tools now, totally unregulated, like AI and social media and all of those things that are serving a purpose. We're seeing inequality gaps growing and growing and growing and still going unchecked. And somehow, we as individuals, grassroots efforts are supposed to fight that well-perfected machine. So I'm curious to hear your thoughts. more systematically what policies, what changes do we need to make to the system? Because no matter how much as individuals or groups of individuals we try, I feel like we're still living in our own echo chamber. We're teaching students science, but we're not teaching them communication, empathy, compassion, how to, survive in the real world with this gigantic mechanism that's working against us.
I think you provided the answer to your own question at the end there. We have to teach people differently. And when I say we have to ask ourselves why we're not trustworthy, it doesn't mean we don't do all that other stuff. I don't think that dismisses the role of people who are profiting from this. I think quite the contrary. I think we have to address both of those things. I think public health for far too long has been too preachy, just set in its ways. It's very slow to react. It's a different world today. So I think to say that we have to think differently doesn't mean that we failed terribly. It just means that we have to adapt, and I don't think we're adapting quickly enough to, how AI is out there. How's public health going to use AI? How do you fight fire with fire? I think those are questions we have to ask ourselves. We have to ask ourselves tough questions like Kumanan said. What's the price of getting to 95% coverage? Is 90 good enough? Is the price we pay for that extra 5 too much? Are we doing too much collateral damage? Those are not questions we ask in public health. They make us uncomfortable, but it's time to do it.
Thanks, Florida. You asked the question, what kind of legislation can we, and that is the question before us. What can we do as a society? And not just you and I, what can government do? And we actually don't know. But I think some things we can do is legally, through policy, through legislation, just make it safer to have these conversations. Like we have politicians afraid to leave their offices for being assaulted. That has to stop. You can pass laws preventing that. You have journalists afraid to talk to some people because they might be assaulted. During the worst of COVID, I knew some journalists with bodyguards because anti-vaxxers would assault them. That needs to be stopped via legislation. Make an environment where science communicators like us aren't getting death threats. Like punish that severely. Maybe look at controlling the digital platforms better. Make their algorithms public, at least to some individuals and governments. They can see what nonsense is being done. So there are things government can do policy-wise, not to stop the problem, but to make it easier for those of us who wish to engage with the problem to do so.
I'd just like to echo Andre's comments. I think public health has to become agile, just like sort of computer programmers are. And you can't be fighting yesterday's battle. Like everything is moving so fast. New platforms are coming online. I think a mindset needs to sort of incorporate. I know we are blaming the tech sector here a lot for a lot of these problems, but maybe adopting the mindset of the tech sector will be very helpful in addressing some of the challenges they've created.
Also building on the discussion about trust, I think many times building trust and addressing misinformation are seen or framed as an emergency response intervention, while in reality, in times of emergencies, we are already overwhelmed by the emergency itself, and we're like, let's build trust. So my question is, how can we move from this to framing trust as an integrated and sustainable public health component where we can build it before emergencies happen, maintain trust, and then use it when the next emergency arrives?
Going back to that issue of the physicians who have parents who don't vaccinate, and that whole thing about we're going to fire them. The best thing that physician can do to make sure that parent eventually vaccinates their kid is to say, you know what, I'm going to tell you what I think, but I'm still going to look after your kid. I'm going to take care of your kid for a few years, and then they will build the trust. The parent will know it wasn't just about that issue. This physician truly does care about their child's health, and you're much more likely then to be able to convince them or persuade them. Yeah, I think that similar mindset we need to do in public health. People may do things we don't agree with all the time, but we're still going to make sure that they remain safe.
I think investing in primary care is probably something that we need to do, not just a public health thing, but a broader health thing. I think about when I was growing up, I had a pediatrician, and I would go see him once a year or a couple times a year as needed, and he would ask not just about my health, but also how was school, how's life, how's my family, while my parents were there with me, obviously. And then I reflect on the fact that a lot of people don't have primary care right now. And so automatically that main pillar of trust is missing. So the person that they would go to for information is no longer available. So I think looking at these larger structural health system issue would go a long way in building trust. If people have access to care, if people have access to trusted sources of information through their physician, then they're less likely to go look elsewhere.
I wrote my thesis on online anti-vaccine argumentation in Canada, which I started 1 year before the pandemic. And so 1 year later, my research was unfortunately timely and relevant. And so I used that to work at Ottawa Public Health, and we trained so many frontline workers on how to have these conversations about vaccination. And so one thing that we learned throughout my thesis was that people have been anti-vaccine since even before vaccination was invented. People were anti-inoculation. So it has a deep rooted history. And I've always said that oftentimes throughout history, science and medicine has never had the best PR people. And so I turn to you today as perhaps science and medicine's PR people. What is your key message to promote vaccination today? Yeah.
This end. We start at that end this time. Give me time to think. The key message is history. Just look at the epidemiologic transition from the age of pestilence to the age of receding pandemics. And how did that achieve? That was achieved through public health investment. Yeah, through clean water and nutrition and all that stuff, but largely through vaccination. You don't need to be an expert to read data. Just ask your grandparents what stuff was like. Ask them about the iron lungs. Ask them about the measles hospitalization and death rates. Then ask them ask them to show them the smallpox scar that I've got, and probably a couple of you have, but a lot of you don't. So history is alive with us today. Just ask the right people. I think that'll sell the message.
Yeah, this came up in our session, and we were sort of speculating. I said, could we make this into like a longevity thing? Like that's the big thing now, and could we sort of use the longevity branding for vaccines and start to have people look at it in a different way, that they can, control their health in a way.
Yeah, I don't have anything new to add, but just to raise point, just storytelling I think works really well. So I was going to say just ask your grandparents about the viruses and the illnesses that existed, because we don't see them anymore, and so it's easy for us to kind of pretend that they've never existed. But my grandmother remembers a time when a lot of her friends and colleagues were being affected by this very, very, very drastically. And so, yeah, speaking to family members, older family members would probably be where I would start.
I'd say to a certain extent, storytelling, of course, very important, but also adapt to the times. So we live in times of very selfish times where people are self-centered. Remind them that the greatest beneficiary of a vaccine is them. A secondary benefit is others. People love supplements and all this crap now. It's a supplement. It helps you prevent getting sick, just like your creatine or whatever you have in your cupboard. So just adapt the message a little bit. But it's been the same message since Jenner, 250 years.
Understandably, thanks for the panel and the conversation. It's really great. Understandably, we not only had one COVID virus, we had different, and we had to learn as we went. Like the first one was totally the insecurity of the institution, the supply chain management and stuff, and we were hoping for the vaccine to come in. Delta was really made people sick, and then we were quite happy when Omicron came, which was a mild version of the virus, but not taking into account the public policies about putting staff that have been in contact with that have contracted the virus, even though if it was a mild virus, to keep them off the hospital. And then we had days where we had 15 to 20% less staff to actually run the hospital and give care. There were changing directive from the ministry, sometimes almost hourly. And for the vaccine mandate, they, like we went all full-fledged with firing some people who didn't get vaccinated at the hospital. So my question is, what kind of harms those directives have done to the system about the vaccine? And the second part of the question is about what have we learned that we will be brighter, more informed when the next pandemic, because there's going to be one, comes, so we don't repeat the mistake of the past.
For those two questions, one was what have we learned, and the first was the harms. The harms is a hard one because, thank you, because yeah, I mean, the harms were mostly to society. Was there control overreach? Maybe there was. At the time, it seemed like the appropriate action at the time. So what we've lost is the ability to put ourselves in the shoes of the time and remember what it was like, remember how scary it was for a lot of people. So I think what we should have leaned into back then was a bit more compassion. Not to change the actions necessarily, but to explain why we're doing them in a more compassionate way. Like, I mean, one of the many legal cases I was on as an expert witness was to say whether or not we could have accommodated these anti-vaxxer nurses with testing regimes or through nudge economics to make it a little bit uncomfortable so they choose to get vaccinated. And the employer very often was, no, get vaccinated or not, right? And there should have been a middle zone, like a testing regime that was, complicated and maybe unpleasant, but at least allowed them to continue to work. So the lesson there was find a compassionate middle ground. The lessons for the next pandemic is, we're screwed. I think we're much less prepared now than we were 6 years ago. And what we need to really invest in this time around is public buy-in. We got to re-win public buy-in. We do nothing unless the public's on our side for everything.
Yeah, I think, early on in the pandemic, the term the precautionary principle was used a lot, and we didn't know what the magnitude of the risk was, and we need to take measures to protect against a catastrophic risk. The precautionary principle came from environment, and it was designed to make a trade-off of protecting the environment versus an economic harm. The problem when you use it in public health is you often create a health harm by providing something that protects against the health. I think what we learned during the pandemic, there were a lot of significant unintended consequences of a lot of the measures we brought, and the school closures are probably the one, and the mental health impacts of that. And I think we're going to be very careful moving forward, looking at the potential implication of decisions like that in the next pandemic, if hopefully there won't be one.
Something else that we think a lot about is also the power asymmetry. That's probably one of the biggest harms, I would say, from the pandemic. So, for instance, the fact that a lot of us, myself included, were going on media and telling folks to stay at home when really a lot of people couldn't stay at home, right? And we're essential workers and whatnot. And so I think it just gave that impression that scientists and public health folks are elitists. And that's probably a perception that we're going to have to fight back for a really long time, including for the next pandemic. Still to this day, sometimes when I was on X, I'm no longer on X anymore, but I used to get comments about, it's easy for you to say that because you're in your cushy, desk job at home. But for those of us who are out and about, it's not easy for us to stay at home. So something like that. And then the other thing that I think about with regards to harm also is the whole communicating the uncertainty piece as well. Still to this day, I received some comments about, you told us initially not to wear masks, and then you told us to wear masks, and then now you're telling us not to, and then now to wear it when there's flu season or respiratory season and whatnot. So I think to Ray's point about the lack of compliance from the public and the need for us to get buy-in from the public well ahead of the next emergency and well ahead of the next pandemic is something that we should be all collectively working on in this in-between period.
I'll just say I think what will happen in the next pandemic is we'll make many mistakes, and we'll make many of the same mistakes. That's what history tells us. And, that's life. Bad things are going to happen. hindsight's always 20/20. I'm not big on looking back and casting aspersions and blame. I don't think it's useful. I think all our policies were well-intentioned, seemed appropriate at the time, and hopefully we've learned a little bit from them. But the last thing I'll say is we have to, if we want to prevent the next pandemic, we have to invest when we don't have a pandemic. That's the big mistake we made last time. We weren't ready. We slashed public health. Now's the time to invest in it when things are calmer.
And I wanted to point out, just in case people haven't read it yet, there's a really great article in Maclean's from September, written by a woman who was an anti-vaxxer who is now pro-vaccine. And she talks about how she got involved in the anti-vax movement. And a lot of what happened to her was the fact that after she had her children, she could not get healthcare professionals to listen to her fears, her concerns, her uncertainty. They kept brushing her off, telling her what to do, and she ended up finding support online. And that support, unfortunately, was a group that was promoting misinformation, and she kind of fell into that. And she talks about how that happened and then how she got out of it. And I think what it really emphasized to me as a healthcare provider is the importance of listening. So it's not just telling people what to do or explaining things in certain ways, and I think those are important things, but the more important thing is being able to ask questions that help you really listen to people. Things like, how does that make you feel? What worries you about it? What do you think about it? Those are the things that I find my patients need in order for them to trust me in what I subsequently explain to them. And I think I've been thinking a lot tonight about a personal situation. My sister-in-law was diagnosed with ALS a few years ago, and her sister asked me, do you think the COVID vaccine caused it? And this was kind of right after the whole convoy occupation, and I was pretty upset and very stressed by everything at work changing on a daily basis. And I really brushed her off. And in retrospect, I realized that that shut her down and probably made her feel more anti-COVID vaccine. And so I think what I want to do when I get home is email her and say, I'm very sorry that I did that, and open up a conversation with her. And I actually have since looked into it, so I feel better about about what I told her. My question for you is really, how do we structurally support physicians, pharmacists, and nurses, our frontline healthcare providers, in having the time to listen to patients' concerns so that they can earn trust in what we subsequently help them with?
That's a tough one. I mean, I hear it all the time also. You need to listen more, and I do. I'm not a listener. But it's hard to listen when you've been called a neo-Nazi, a racial slur, and a whole bunch of things, and gotten a death threat, and then suddenly, you don't listen to me. Like, so it's asking a lot of frontline people and communicators to be purveyors of information, to be rigid and robust against assault, and at the same time be empathetic and listening. But that's what's being called upon to do. So how do we support people who do these things? You give them more time, you give them more peace, you give them more money, you give them more resources, and hope for the best. That's my best answer, sadly.
Just to echo Ray as well, I think pharmacists do a phenomenal job at that. So we know that over the last little bit, pharmacists have more and more taken on the role to provide vaccines. And so I can speak from my family's personal experience. My mom has needle phobia, and so she's really, really scared when she gets vaccinated. But when we go to our local pharmacist, he sits down with her, talks her through it, calms her down. There's a separate room, and I think they have a lot more time than primary care providers, unfortunately, like physicians and nurses. So I think just leaning into the network of pharmacists that we have is probably one way that could work.
I think the operative sort of psychological issue here is reactance, and why don't they listen? And they're going against your core belief, like they're not trusting you, and that can be very upsetting to a lot of clinicians. I argue or put forward the idea that empathy is important, but as a physician, you sympathize and be detached, because if you're too vested, then you get upset that way. You're not trying to be their friend; you're trying to get them better, and you obviously and so. I think keeping yourself sufficiently removed so you don't get caught in that reactance and really taking things personally is important when you're dealing with those issues.
I'm actually pretty young. Like I just turned 19 like last month. So, but as a young person, like more and more, I'm seeing that like. AI is kind of taken over. You guys talked a lot about how like staying in an ecosystem and about how people using people around you, you get like you build these experiences and you get stuck in your own ways. But like I feel like more and more young people are not doing that. Like they're doing that to a different degree. With the rise of AI, you see like it's been in the media all over about like the idea of like AI therapy, about like kids typing online saying, oh, I have a problem with these mental health issues, or I'm feeling like this, and they type it in, they want AI to answer. And that's because like a socioeconomic issue, blah, blah, blah. But what I want to get on like to the main heart of it is like, how do we confront that? Because like, more and more, I'm seeing people like around me, they're typing into AI, they're asking questions. That's how they're getting their medical information. And they're not meaning to like get this misinformation, and they're not meaning to then spread that as disinformation. They're just trying to figure out like what they are, and they're asking and they're trying to figure it out, but they don't want to ask a professional because, there's a whole thing about like, oh, people can't trust the media anymore, we can't trust our politicians, we can't trust anything, so now I have to trust my influencers, I have to trust AI, I have to trust other things of that outlet. And it's becoming more and more where it's like, people aren't trying to be not knowledgeable, especially when they're young. They just don't know any better. And they haven't had those experiences like many of you about getting the jab in your arm, right? They don't know those experiences. And to them, like, all they saw was COVID, and they saw the misinformation. They're like, okay, I'm done. I'm just gonna turn to ChatGPT for any of my. If I stub my toe, I'm gonna look at the meta overview of that's what I need to do. So my question is like, how do we confront that? Like as a young person, I don't know any of the things that happened in the past. I'm not a medical expert, like I said, but yet I want to know more about this, and I find more and more that I don't know, right?
Coming out and asking that, we need the input, obviously, of the younger generations, because there's a lot we don't know about how the world works now. The weird thing about AI, first of all, I think one of the reasons people like using AI, and it's an incredibly valuable tool for education, because you're not embarrassed by asking a stupid question, right? And I think that's really helpful for people to learn. But what I noticed, the weird thing about AI is, so we talk about this echo chamber phenomenon, right? We're in a social media group and it's an echo chamber. In AI, you're your own echo chamber. It's like following you from what you've said before, and it wants to affirm you, so it gives you back your own. So that's a really strange thing. I've sometimes noticed that, saying, are you just telling me this because I talked about that earlier? And it will say yes. And I say, can you forget my previous conversations? Like, I have to tell it to forget my previous conversations because this is not helpful. So I think there's prompt engineering or whatever. I think those are skills that are going to need to be taught in school, how to create profiles and stuff so that you get the information you actually want to get.
I was going to ask you the question. What do you think would work in order to get the right type of information? Like, what kind of information are you more leaning towards? Are you just getting it from TikTok? What would be helpful for you so that you would want to understand science and public health better?
Speaking for me, like if I'm getting my medical research and stuff like that, I am a person who likes to research stuff. But if I'm talking for like most of my friends or people that I know and like that, a lot of that is coming from like influencers, or it's coming from like forums that they see online or something like that. And like you guys talked a lot about like Twitter and stuff like that, but I feel like more and more young people, we're not on Twitter, we're not doing that. We're on Instagram Reels scrolling for days on end, and sometimes we see something about this is what's going on or this is the health thing. So maybe it's not about like confronting like a big bad person like RFK or somebody, but like maybe it's like more about confronting like these small little things that like hurt the idea of misinformation. It's hurting us because we don't realize what we're slowly becoming, you know?
Stuck there? Thanks. I wonder if Florida has any insights on this. Do you have any insights? She works in the field, so I'm wondering.
I mean, I don't have answers. I know that like we've talked about this, that like 19-year-olds, 20-year-olds, teenagers are not on Facebook anymore. I follow a lot of you on Facebook and on Instagram. I still read news, you know, the traditional media, but youth is not there. The bigger problem that I see with AI, and that's why my question was mostly around like policy and regulation. Prompt engineering is one part. Again, it's on the end user. The thing we don't talk about is evaluations of these models. So when AI gives you an answer, there is a group of engineers behind it that has trained AI to give you that answer. It has trained AI to tell you this is the truth, this is not the truth. And this group of individuals, they're humans, they're biased, and they also have agendas. Just recently, OpenAI, for example, announced that now they're going to have ads in their platform on ChatGPT. And now they already have tiers. You have to pay for certain levels of access. And so that goes back to what they're feeding you now, how they're training those models, what is the evaluation mechanisms for the responses you're getting. I feel like with AI, we are barely scratching the surface, and the thing that worries me the most is that, you know, we have this generation that's already using AI. We have an industry that already knows how to lobby, and we have a panel of experts that says, yeah, we need policies, but we don't know what policies those are. And that's really worrisome and concerning, because for the next pandemic, we're still unprepared. As experts of public health, it seems like we still don't know what's the next thing we should be doing. So I'm sorry I don't have an answer. I have more questions.
So I have a few points. The first point is sharing a personal story, because usually when people speak, you tend to reflect. So I come from a country where people were grappling with HIV, many killer diseases, and after the recovery from a guerrilla war. So the health system was all jumbled up. So what they did when I was growing up, I had to learn about what they called the killer diseases, measles and all those things. And then we had to appreciate how is it, what's the effect, how does it affect society, and in turn, what solutions are there. There were solutions like preventing some diseases like diarrhea or HIV or things like that. But then there were also diseases that can't be prevented really using such means. So we had to learn about vaccination when you're young. So when somebody was speaking of learning about vaccination, it drew me to 5-year-old me seated somewhere in a little classroom learning about killer diseases and how to cure them through other means, including vaccination. So from a young age, I grew up appreciating it. Even when one of my siblings had an issue and somebody said, oh, perhaps it's because of the vaccine, my mom, maybe as a teacher, was strong enough to say, no, there are killer diseases and people need to be immunized. So being strong, but also training people when they're young could be a solution. Then speaking of engaging with tribes, groups, clusters, my research was about how laws, policies, and procedure influence the health of immigrants and newcomers. And throughout the conversation, I came in a little bit late. I don't know if we touched about certain clusters of people, because from my research, I tended to realize that minorities such as immigrants, refugees, or even the first, I don't know the best terminology, but the indigenous population, they tend to have mistrust. So how are we going to communicate to such people in a way? One of the solutions is, in my country, how they did it was cultural leaders, people who really speak the same language as those communities that you want to talk to. So in this case, people who are people in that tribe can lead the way. Do they lead by example? I just did a little Google search here while listening, and I was wondering if a particular head of a particular province, I won't be very specific, owing to their political alienation, are they pro-vaccines or anti-vaccines? And I was happy to learn that they were encouraging people to vaccinate. So when people who identify like those people are the ones communicating, they tend to hear. So that brings me to another question. Who makes policies? Who makes decisions? So if I see nobody like me among the decision makers, yet I know there are people like me who are in the healthcare system, who are dealing in such things, but they're not involved, so why should I be involved? How is it attracting? Right? So trying to balance all that and trying to understand that this is about people trusting. You may be right. Do I trust you? It's about how you communicate. So that brings in another question. How do you communicate and who communicates? Yeah. And then my last point will be that vaccines do not work in isolation. When I came in quite late, so I had to ask my neighbor, did they talk about trusting the Canadian healthcare system as a whole? Is the Canadian healthcare system trusted? I'm not saying it's not. I'm not saying it is. But maybe I trust it. Does everybody trust it? So vaccines do not work in isolation. They work in the entire healthcare system. And I know I said lastly, but then another point. As somebody who has been in the university for the largest part, no, in school for the largest part of my life with little or no work experience, I think creating curricula that does not only look at the younger people, but also at university level. Maybe we have the director for the Center for Health Law. Can we have a course about this? I know there are very many other urgent things, but how can we have courses or conversations about this? More courses, because now public health is an issue that doesn't affect only a small population, but affects everyone. So I think it takes a little bit of priority in terms of education and training. Thank you so much.
Well, yeah, I think you answered your own question with the idea of having champions within the communities communicate for us, and we have to realize how hard it is for those people. And we need to support them and listen to them as well, because again, these other viewpoints sometimes have validity, and we need to listen to them. But they can be in jeopardy in their community if they're stepped too far. Like, they have to bring that community along slowly. And they have to maintain their own trust. So I think that was a great point, and I think that strategy, we need to figure out how to keep extending it to harder and harder to reach communities.
I'll just add a small point to your point about the diversity of leadership and diversity of experts. I think during COVID, we saw a lot of the same people on TV and on media. Obviously, they were renowned scientists and experts and public health folks. But I wonder if there's a way for us to look a little bit deeper and get folks from lots of different communities to do media when there's an emergency, so that people can see themselves on screen rather than the usual suspects. So thank you for that point. I think it's a really important one.
Answer more your questions, but one thing I want to point out is the battle against misinformation is asymmetric warfare. They drop the bombs when we don't know they're coming. Suddenly a YouTube video is dropped, gets 7 million views, spreading nonsense about a vaccine. Then we got to rush and respond to it. So we're always on our heels trying to catch up to what's going on. And one of the strategies is to undermine the strategy of cultural champions. So we identify a champion from within a community, and they will be advocating for vaccines or other public health measures. An easy technique by the proponents of asymmetric warfare is character assassination. It happens all the time. The second you identify yourself as someone who is pro-public health, there's a subtle campaign to undermine your credibility. So how do we deal with that? I'm not sure. I think that's where you go back to these other, policy ideas around attacking the digital platforms or doing other kinds of social media work. That's not a solution, I know. It's just it's pointing out that it's not champions within groups is not a panacea, sadly.
One more, sorry. I was reflecting, this is not at all related to your point, but to yours about the AI question. I was reflecting a little bit more on that. And I was thinking if there was a way, to your point about the database that's used, that AI uses, and how misinformation is spread. I wonder if there's a way for trusted institutions or institutions like U of Ottawa, like universities, like hospitals, to partner with AI companies. I feel a little icky saying that, but also they exist and they are not going anywhere. So if there was a way for us to have a say in the database, so that because I think a lot of it is also ease of information, right? You just go on ChatGPT, you search for it, it's there, the answer's there, it speaks to you in a way that you can understand. It's not, stuck in a link somewhere. So perhaps that's something that we can explore as well, and maybe that already exists, I'm not sure, but partnerships between universities and AI companies, where universities fuel the data that goes into specific AI platforms. So that young folks and everybody can use that. I'm sure my older aunts and uncles, for example, would also really appreciate using something like that because of how useful it is. So if we can find a way to provide evidence-based information in these databases, then maybe that's something we can explore.
The phrase that comes to mind is sand in the gears. You've been rather bashful about talking about policy, but the federal government in the budget is talking about $1 billion in AI infrastructure. My impression so far is that the Minister for AI is keen on the commercial aspects, but not so much on the safeguards. My impression is that Silicon Valley and Trump would get apoplectic if Canada, Canada's already backed down on some sort of digital legislation. But why be sort of agnostic and throw up your hands? What about, are there not enough people in this room with some creativity who can come up with some more concrete policy suggestions for Evan Solomon and his minions right now, today, to say, here's some ways to put the sand in the gears so that the 7 million people watching a particular YouTube there, it doesn't happen because the 7 million doesn't happen right away.
Florida? No? Answers? I will put AI is complicated. I mean, there's task AI, which is what most of the billion is geared towards. Task AI drives industry and development and so forth, but generative AI is what's confusing the communications aspect of it. And I don't know if government is focused on that. I really don't. But, or even if they want to throw sand in the gears, I don't know. So I'm hoping, Florida, save us.
I mean, I think the challenge is changing so fast. So I'm on the scientific advisory committee for digital products for Health Canada, and we started with static, just digital, apps and stuff, and then machine learning came along, and then generative AI. It's just constantly changing. By the time you get a set of policies for one technology, the technology has advanced. I think your point is, I think maybe the best way to combat it is to create better products and gated. So I think New England Journal has Open Evidence, which is a peer-reviewed AI, and so I think maybe we just need to create better products and hopefully win in the marketplace.
Just to make a comment, in a long time ago, medical professionals could do harm and did do harm. And at a certain point, we decided they needed to be regulated. And now we're regulated. So what happened with Andrew Wakefield was he got struck off the medical register. So he's now Mr. Andrew Wakefield. That's not the case for AI. We haven't, you said it's an unregulated, Florida, you just said that. So, and it also parallels the issue of social media, and the mainstream media have to tell the truth, but the social media don't. They're not. They don't. It doesn't count as publishing. They take no accountability. So, to me, there's some really powerful regulatory tools we could put in place that would stop misinformation in social media and would make AI accountable, or the companies that make AI accountable when they say things that are wrong. I by mistake did an AI search. I was doing a Google search looking for a document that I knew existed at the weekend, what used to exist on the Toronto Public Health website, but I didn't cancel the AI bit, so I got an AI answer from in my Google search that was wrong. The answer was definitely wrong, and it had a citation. So I thought, oh, that's weird. Why is it saying that? That is wrong. And I looked at the citation, and it was a different document, and it had pulled the wrong bit of a table that was actually on the Toronto Public Health website, but it was incorrect advice that anybody who, like our friend at the back, if he'd been looking for an answer to how long do I have to stay away from a newborn baby when I have hand, foot, and mouth disease, would have thought, oh, I'm okay now, when actually you wouldn't have been okay because it pulled the answer from chickenpox instead of... Anyway, it was just a... but that's just one little example. Like, it's happening all the time. People are getting, frankly, wrong advice because AI is not a human being, and AI works best when it's paired with a human being. So I think we need to get regulating, but it's just, you need to have politicians with a lot of courage to take on these, the tech bros who are running the world at the moment and who have more money than any of us. So, yeah.
Here for a bit. Yes, it makes mistakes. So do we. And they've done the studies, and I mean, I know they only publish a study. They give us the cool answers, but they said, you can get AI plus a human, or just AI, and AI is the best, and AI plus a human was worse, just for diagnosis. And that's because the humans didn't convince the AI it was wrong when it was right. AI it's got obviously biases in its machine learning, but we have biases as well. I mean, we have algorithms that we use intuitively that make errors. So I acknowledge that there's misinformation, there's hallucinations, all of that happens, but humans also have those similar flaws.
You're absolutely right, Kumanan, but you're regulated and AI isn't. So when you make a mistake or I make a mistake, we can be held accountable for that. If we give someone incorrect information, we can be held accountable. The moment AI can't be. So I'm not saying that we're always right and they're always wrong. I'm just saying that we have a mechanism for making sure that and the point being not the regulation itself, but the companies that produce these tools will think differently if they know that they will be sued if somebody decides to... I was reading a thing about, free birthing. I don't know if you heard about that, but there are these movements that people get caught up in that are frankly dangerous. Babies have died in child, before even having a chance of being born as a result of these kinds of things that can come up as being, oh yes, that's a good way to have a baby. It's like just stuff that's out there that if you ask the wrong question, you're going to get the wrong answer, and nobody's accountable for it. And that's all. I'm just saying they should have the same level of accountability as you and I.
All right, I'm going to hold us there. Been excellent questions and a very rich conversation. I am going to give our panelists, if they'd like, any last words, final comments. Ray is saying no. Well, Ray is shaking his head. He's done. Anyone want to close with anything? No. Thank you. Thank you for a wonderful evening. Thank you to our panelists. Thank you to the staff for taking care of us this evening. And I wish you a wonderful rest of your evening. Thanks again.